thank you so much for taking the time with me today. I'm excited to hear more about what you're building at IKONA Health. You know, my understanding is you've taken a really novel approach to kidney disease that involves virtual reality, which is really not something that you hear a lot about. So really break it down for me.
Will do, happy to. So IKONA Health, big picture, is a learning technology company that is powering learning in kidney care specifically, and we're starting with home dialysis. So the way this looks is we use our first commercial product, which is a virtual reality experience for patients who are on in-center hemodialysis, to help them understand and familiarize them with home treatment options. So imagine you put on a headset, you're a patient, you go into another patient's home and you experience a day in the life of going through this decision as the patient who has already done this before you. And that is a very powerful treatment decision tool for someone thinking about, can this fit into my life? And that's the specific application of VR in this one context we're talking about.
So help us understand this market of kidney disease. Let's talk about actual patients and the challenges that they face in terms of getting dialysis, why they would move to the home setting, and just some of the big factors there.
Absolutely. So it is a enormous issue to say the very least. So 1 in 7 Americans today has kidney disease, 37 million, more than diabetes, but it's a silent killer. There are very few symptoms. So most people who end up on dialysis whose kidneys have failed are crashing onto dialysis, meaning they're ending up in the emergency room and they don't know what's wrong with them, and they're being told your kidneys have failed. So all the while they didn't know they had kidney disease. So for a lot of these patients, they're transitioning from the hospital to a brick and mortar outpatient dialysis center, and there are close to 8,000 of them across the country. So for 4 hours at a time, 3 to 4 days a week, they go and they receive their treatment. It's not a great experience. The quality of life is not very good. And what we're seeing in this country, and it's actually been pushed by recent legislation that has changed this and required companies who provide the care to transition patients home. A huge barrier, because this is still a patient's decision, is seeing themselves being able to do home dialysis. This is not a small decision. This is a massive life change. There are a lot of reasons why it might be a great fit for every patient, but the biggest barrier is fear. It's anxiety around, how can I possibly make this decision? What if something goes wrong? Right when I'm in the center, yes, it's miserable, but there's a whole team here to help me. Can I really do this on my own? So that's what we are trying to address with VR. What VR does, it's an empathy machine. We've heard that often, right? It elicits this emotional center in the brain that if fear is your greatest barrier for the patient, and we can use a tool to minimize those fears and then get through on the education front, now all of a sudden we're seeing more and more people choose home at a fraction of the time. So it's really about addressing fears with a unique tool.
So what I'm hearing is, in healthcare, we have realized the importance of moving people in dialysis from centers to the home.
Yes.
But there's this fear element. If you didn't have IKONA and the VR to kind of experience that move to home and to build up that comfort, tell me kind of what's the standard of care now before that?
Yeah, so right now the easiest way is what happens in most of healthcare. It's a conversation being had with a frontline health professional, and in the kidney care, especially the dialysis setting, you're talking about technicians who operate the machines, the nurses who are running around to 30 different patients during a treatment session, giving them a handout, a PDF, maybe saying, a nephrologist has said this might be a candidate for home, so next time I see them on my monthly rotation, we'll talk about it for 7 minutes. That's just the standard of care. It's not happening, right? This is a huge decision. Oftentimes, a patient has tried to go home, something just didn't work, and we can get into that. It's a very separate topic. There's a lot of reasons why going home is not a solve. There's still a lot of work to be done. Some patients end up back in center with tough stories about, it just kind of clouds the environment. So the standard of care is the same old face-to-face conversation. It's not scalable. It's highly variable. If you don't have a great nurse who understands home, you can't really expect them to talk about it. So part of what we do is not just educate patients, it's also standardize and improve the confidence of the person delivering that education at the front line. So we actually see 37% average increase in confidence among frontline health professionals,
Gotcha.
in addition to the reductions in anxiety for patients. So that kind of bridging the gap for that care communication at the point of care is just absolutely vital when you're talking about such a huge shift that's going to change the way the industry is done.
Let's talk a little bit more about some of those patient metrics. How effective is this empathy machine when it comes to making patients feel more comfortable about making a move that's good for their health?
Yeah, so in this specific case, we're seeing 3 to 4 times increases in home adoption compared to the benchmarks by the companies, the dialysis providers we serve.
Yeah.
And so when you think about 3 to 4 times on numbers that have to be, currently that 10% of patients, about 10 to 12% are at home, we have to get to 80% in the next few years. So this new legislation that was passed, we're about to see the standard be patients moving home and patients having access to kidney transplants, because that's another huge barrier for our patient populations who have kidney failure. So it's an exciting time, but we are seeing, with just this VR tool alone, huge increases in the number of patients moving home.
This is a relatively novel application of this technology, and so that alone is impactful to get to people in a different way. But obviously, how you talk to them, how the content is developed, is also hugely important. So, how big of a piece is just your strategy and mentality around how you create the VR content itself?
Yeah, creating the content is probably where one of the largest moats differentiators for us is. That process is not easy. And obviously you understand how production can be complicated, all the moving pieces and parts and skill sets that go into creating something that is related to film production. Well, the same is true in VR, but there are some caveats when it comes to shooting let's say we're talking about 360 video, where a story is being told. You can't cut in the middle of a scene. You have to go and take your best take and have someone who's very genuine. If you have a patient who's telling a story, they're probably telling a story to a really interesting looking contraption that we have to figure out, how do we get this right? How do we make sure that the interactive elements are such a way that we can measure them to ensure we're getting ROI for our customers, but also driving meaningful outcomes for the patients? And then we have physiological factors to take into account. The patients we're working with are sick patients, right? We might have cognitive impairment, visual impairment. How can we make sure that we are not setting up those patients for any sort of difficulty? Because we know that whether we deploy in a controlled clinical setting in the practice or in the home, the product has to work. It can't fail. And when you're talking about VR, that can be a tall ask. So we're very grateful to have some very innovative, forward-thinking partners that we work with in the industry who can see the value of the tool, because we've spent years validating and building with them to get the results that they're looking for. And so we're at a phase where now scale is kind of the question at hand.
Okay. Quick final question.
Sure.
What's next for IKONA? I understand you're moving beyond VR, you're expanding your repertoire.
We are. I think COVID was a forcing function for many in digital health. For us, that came in the form of thinking beyond VR. So we have a product pipeline of tools that are learning tools that address challenges, education challenges across kidney care. So thinking about dialysis, it's not just, can we help this patient understand what home is and move home? It is, how do we prepare this patient for going home? How do we make sure that once they are home, they are well supported and they are not going to end up back in center, which is happening to more than 50% of patients that transition home.
Wow.
There are a lot of tremendous challenges that are education challenges that can help us address workforce shortages, address the staggering number of patients with CKD who are in primary care, missing their diagnosis and then crashing later on dialysis. So there's a whole range within kidney care alone of applications where we are developing tools that are either in funding now or we have in the pipeline with commercial partners.
Tim, thank you for taking the time with me. I really appreciate what you're working on, what you're building around patient education. The VR side is exciting and novel, but really it's much bigger than that, obviously. It's about reaching patients where they're at to help them make those good decisions for their health. So thank you for taking the time.
Thank you for having me, Logan.
Best of luck.